So talking about UNFPA, so yes, we are supporting in India, but globally we have a huge impact on the midwifery. We have supported in more than 125 countries and trained close to 550,000 midwives across the globe. And we have supported nearly 1600 midwifery schools in different parameters, whether you can say providing them equipments, providing them trained people, and many more. In India, we are working since 1974 and in partner with the Government of India Ministry of Health in different states with different state governments. And our focus states are Bihar, MP, Odisha, Rajasthan, along with Punjab. And we work toward achieving 3 transformative results that promise to change the world for every woman, man, and young person by 2030. And these 3 results are: one is ending preventable maternal death, second is ending the unmet need for family planning, and third is ending gender-based violence and harmful practices. Next, talking about our support under midwifery. So as I mentioned, Punjab, Rajasthan, Bihar, Odisha, and Madhya Pradesh. Our functional centers are in Rajasthan and Punjab. Few more centers, especially in SMTI in Kota in Rajasthan, Jalandhar in Punjab, are going to be functional in coming months. Beside that, there are more SMTI will be functional in Bihar and MP also. So we'll be catering a lot of centers maybe in next few months. These are some of the pictures from our NMTI and SMTI. So you can see that skill lab establishment, then classroom, and there are debriefing rooms, virtual lab at the NMTI established. So you've seen that part. There are 2 labs already been established, one in Jaipur, one in Udaipur, and one in Patiala also, which has been used especially on 2 modules on the PPH part and NTSL. Then we have also placed 4 IMEs, international midwives also, 2 in Rajasthan and 2 in Punjab also. And in the functional, we have the functional MLCUs also, wherein normal deliveries are happening and are being done by these midwifery educators and even the NPMs also. Next slide, please. Next slide. So now, this is a very important slide, I can say, wherein I am going to discuss the current status and also the kind of support or the kind of more forces we need to increase. One is so talking about the current status. So obviously guidelines on the scope of practice already released by Government of India. IMEs are providing the training, but you all know that that is not the sustainable solution. That's not a very cost-effective solution also. So we need to find our ways to transfer that role from IMEs to MEs also. And a lot of partners are doing that also. Please. On the last slide, please. So talking about, obviously, currently INC is looking after the cadre and delayed implementation of NNC Act that is been there. What I can say is no formal regulation on midwifery working condition. That also is a very big concern, what we have seen in different areas. Then talking about the career progression, that is also need to be worked out. That is not very clear. So the MEs or the NPMs who are coming to these institutions, they are not very clear on the career progression. All the Government of India and state are trying to make it clear, but we need to work on that process also, that is very necessary for them, and to take more people into this profession. Then, no, please take on to this current slide only. Then talking about the deployment. So currently, state governments are taking midwives either from their NPM, the NHM, or from their regular cadre. So there is a need also to talk on that. When is a time when these midwives can be taken directly? So we need to think on that front also. Then there are lack of standards and regulation for midwifery scope of practice also, and there is a disparity among different states also. So we need to work on that also. Then yes, we have taken the curriculum and other things from the ICM and is regulated. But what I wanted to mention here is, when IEMs will not be there, we need to put in some check and balances. We need to do something on that front, wherein ICM standards need to be checked and checked every time and time. And why I'm saying so, to sustain that quality of midwives, that is very much necessary. Then talking about the establishing midwifery as a specialized stream within nursing also. So that is so currently that 18-month course is there, but we can think on establishing midwifery as a specialized stream. Then implement direct entry midwifery education for an independent cadre also. These are some of the food for thought, and we need to work on that so that we can have a quality midwifery courses and strength. Next slide, please. Now talking about the strengthening midwifery education. So UNFPA along with ICM, they have carved out nearly 7 points wherein which can help putting midwifery on the forefront. So few I am mentioning here on the sustainable funding and governance of midwifery education, that is very much necessary in the current scenario. Then talking about the enhanced curriculum design and clinical training side, strengthening monitoring and evaluation framework, and promote advocacy for midwifery profession. So these are the most important things which can be helpful to make the midwifery strengthen. Next slide, please. Talking about the clear roles, collaboration, and shared decision making between midwives and obstetrician. That is what we keep seeing that conflict. So we need to provide a good quality orientation to the obstetrician and the other cadre also, to putting the midwifery cadre in the forefront. Then joint professional training and efficient referral system is required. Advocacy and high quality services demonstration is very much required, so that this can help the strengthen midwifery services to improve maternal and newborn health outcomes. Next slide, please, and the last one, I think. Yes. So I think this is the most important, how SOMI can support the growth of midwifery in India. So I was discussing with your president and with other people. You have a big strength, and you are the one who can help actually in taking the midwifery to the next level. So few of the points I can mention here, like expanding the membership. As you have the people, but what I'm talking about, those people who are passed out from these NMTIs or SMTIs, obviously you have that manpower with you, but if you can take that strength also under you, that would be very much helpful. And out of that number, if you can make few people the quality experts and giving them the quality training, so that they can be kind of master trainers and helping the other MEs or even NPMs for the training. So that is one request from your side, from our side. Then quality education and training, uphold high education standards, offer leadership programs, and promote evidence-based practices. So currently these people passing out from the NMTI or SMTI, they are being posted in different institutions. But if you can put those people under different leadership roles, that would be very much helpful for the people who wanting to come to the midwifery pipe. Next is the advocacy and policy influence. So at least the current time we can see that there is a lot of advocacy is required, not from the government side, not from the UN side, but from your side, and you people are doing that. But I am just reiterating that part, that more advocacy is required on that front. Then push for the expanded midwifery roles, career pathway, that is what we have discussed, better reimbursement and public awareness initiatives. Even if we have functional MTIs, even if we have functional SMTIs, but there is a requirement of awareness among the common people. People are not aware about that. So as I mentioned my example, talking about that postnatal woman, she was, although very happy to see that there people are, talking to me about my experience. So that kind of awareness is very much required. Professional development and mentoring, build a strong network of skilled mentors, and that you can do. And that those mentors can be helpful in putting midwifery to different institutions, leadership opportunities, and stakeholder engagement. Next is the workplace and equity support. So currently, the kind of working conditions they have, the resources they have, and the workforce diversity, we need to work on that front. And SOMI is, I think, the solution. You people can help out in this. Last but not the least, enhancing care models, implement framework like midwifery services framework to improve maternal and postnatal care outcomes. So these are few requests from our side, from SOMI, and we together can work on that front, and we are happy to share our support in that front also. Thank you.
Thank you so much for giving the overview about the strengthening of the structure and the functional of the institution. Please sit down. And you have raised the issues also. We are thinking also these are the issues are there. I think the SOMI will work, and we need a support also, and from UNFPA also. I think you will keep support this, because without the professional and the support from the agency and the others also, we cannot move alone. So thank you once again. So may I request, please introduce the next.
Thank you, sir, for your wonderful session. Now we are welcoming to Mrs. Amita Sravantika. She is BSc and MSc nurse practitioner in midwifery educator, NPME, lecturer at Government College of Nursing, Vanapati, Telangana, and presently deputed as a national midwifery educator to National Midwifery Training Institute, Government College of Nursing, Secunderabad, who underwent training at NMTI Fernandez Foundation, Hyderabad, in collaboration with CHFW and UNICEF. She actively involved with the state government in analysis and awareness creation and training to reduce irritational cesarean section in public hospital in Telangana. She was a facilitator for many government projects such as SNBT, Dakshata, Laksh, breastfeeding, NQAS, POCQI, etc. Contributed to the global work of World Health Organization in the piloting of essential child birth care course, ECBC module. Thank you, madam, and we are welcoming you for your session.
Anita, actually we are in a trouble also. There is so many issues are there, and the important issues is there, the legal framework and the professional standards to practice for the midwives only. So may I request you, please proceed and say about this.
So all the Assamese, thank you everyone. Very good morning to everyone. Respected President SOMI and secretary and the chairperson, moderator, all the dignitaries over here. Thank you. Good morning and namaskar. Amitoma Usargita Hoegeshi. We are fida for the Assam tea. We have been fida for the Assam beauty, and we have been fida for the hospitality, all teas from the Assam. Thank you so much for making this a memorable event for us. So this is a small introduction about me. And this is the thing, that is structural and functional changes to promote midwifery in India. And already we have been discussing all these 2 days about the guidelines of midwifery services in India. Already we know. I request each one of you over here to go through these guidelines, and you'll be knowing the more about midwifery services in India. And it has been started in 2018, all these guidelines were framed. And according to the commitment, GOI has committed to educate 90,000 midwives in India, and they will be called as the nurse practitioners and midwifery, and also nurse practitioners, midwifery educators. Mostly they will be working in the MLCOs, and they will be promoting the care for the sexual, reproductive, maternal, newborn and healthcare services. This is the guidelines of midwifery services in India. And according to the evidence, we all know that 4.3 million live births will be there on, by 2035. So when midwifery, the evidence based has shown that if midwifery care are provided, we can avert 67% of maternal deaths, 64% of neonatal, 65% of stillbirths. And midwifery can provide 90% of sexual, reproductive, maternal, neonatal, adolescent health, and this is strongly affirmed by the SOMI report of 2021, and UNFPA funds is there over here, and WHO and the ICM also. It's under the flagship, we can say that. And actually we don't have a legal framework, and now at a national level we have seen that INC is supporting for the NPM course, and at the state level, the state nursing registration counselings are supporting. And you can see the other side is the gazette we have framed for the NPM course and the NPME courses. And now we know that the NNMC Act has been formed in 2023, and we are due to the implementation. Act is there. The 2 years back we got this act, but still we are due for the implementation of the act. So I request the policymakers to make fast action so that we can accelerate the action and we can utilize this NNMC Act. And why this act is exactly started? To develop the standards of nursing and midwifery education, to make the assessments for the maintenance of the registers of nurses and midwives, and the creation of the system to improve access for the research and development. That is the main thing why the NNMC Commission has been started, and this all things are there. And at the adoption of scientific development, whenever we want to progress in the maternal, neonatal or in the midwifery or in the improvement of any health services, we need to adopt this all the policies. So the policymakers should make a fast method to implement this act. So coming to the, according to the NNMC Act, what is exactly the midwifery? Already we have been discussed. Midwifery is nothing but it is a skilled, knowledgeable, compassionate care, and this all preventive, promotive, detection of complications, accessing medical care, appropriate and timely referrals, and mainly carrying out the scope of practice. Scope of practice is very important, what we exactly see in the ICM guidelines also. And this is also supported by the NNMC. In NNMC Act, we will be seeing what is the midwifery associate, who is the midwifery professional, and this is according to the NNMC Act that nurse practitioner midwifery in midwifery, the name itself means a licensed nurse and formally recognized advanced education and training program acquired a requisite qualification, granted license to practice. This is exactly what is written in the NNMC Act. And here, the person who has been called as a NPM or NPME, she should have a clinical competency, she should practice a scope of practice, she should make a complex decisions, and should have an expert knowledge in the area of specialization, especially in the midwifery. It is a commitment, it is a knowledge, it is a skill that is required over here. And the NNMC, these are the three bodies where the Act has stated, that is the central government should constitute a commission, National Nursing and Midwifery Commission at the central level, and autonomous body where we'll be seeing the undergraduate and postgraduate education board under NNMC, and there will be a nursing and midwifery assessment and rating board under NNMC, and the Nursing and Midwifery Ethics and Registration Board. All these legal frameworks will be getting only if we implement this act properly, then only we can implement all these regulations from the NNMC. And every state will be having a state nursing and midwifery commission if this act is implemented. And according to this act, we will be having an online and live Indian nurses registered under this act if this is implemented. And other miscellaneous things are, the nursing and midwifery will become autonomous if the act is implemented, and the Board of Nursing and Midwifery Advisory Councils will be formed, and the directions of the central government will be there, and obligations of the university, and it will be directed by the NNMC Act. All the university and colleges also will be activated, and completion of course and licensure will be given through this act itself. And the chairman and the members of the act will be the public servants. And coming to the other things, there will be a legal protection if this act is passed, and already it is passed, it has to be implemented. And the power of central government to supersede the National Commission, there will be a rules for every nurse and midwife, and it will be having a power to make the regulations and laying the rules, regulations, notification by the Parliament, and power to remove all the difficulties, whatever the difficulties the nursing and midwifery fraternity is facing, that will be removed through this act. And repeal and saving transitory provisions. So coming to the scope of practice, exactly what is the scope of practice? All the students we have listened, they were first only the 4th scope of practice, but recently the ICM has included the cross-functional competences for midwifery practice. First it was only the general competences, now the cross-sectional competences are added, and among that, the adolescent health is also given a main focus in this scope of midwifery. So here we are, general competences of midwifery practice, sexual and reproductive health, antenatal care during the labor and birth, ongoing care of the woman and newborn. So, is the midwifery autonomous profession in India? No, it is not. Only if the act will be implemented, then only we will be calling as a independent nurse practitioners. So what are the recommendations? The midwifery should be a separate profession, and we should have our own scope of practice, and we should give, the policy maker should give us that autonomous thing to practice, and promote direct entry to midwifery programs, strengthening midwifery education and training, implementing MLCUs, and which prioritize women and their preferences. So first we need to address the cultural and societal barriers. We all know who is the head of our hospitals, so that barrier should be demolished, and efforts should be made to address the barriers which will be preventing the women from seeking the care from the midwives. Always the woman will be going to the OB-GYN instead of midwives. So that barrier should be broken. So advocacy for the policy changes. So I request all the policy makers, whoever are here, to advocate for midwifery and make this as a midwifery autonomy, such as allowing midwife to practice independently as a independent midwifery practitioners. So, mainly how can we promote the midwifery into practice? Only through the establishment of midwifery-led care units. This also many of us don't know. They are the guidelines on operational of the midwifery units. So this is also the other document. Each and every of the midwife or whoever is there in this hall, I request everyone to go through this guidelines, which will be stating very clearly how can we operate the MLCUs. So in this, the main components are providing respectful maternity care, which we are speaking always, and encouraging physiological birth and birth companion of choice with the mother during her birthing, and skilled personnel. Skill means not only a skill, the midwife should be with the knowledge, and she should have a compassion towards midwifery, and she should be developing the skill. And evidence-based best midwifery practices should be in the midwifery-led care model. Coming, please, yeah.
Make it shorter.
Yeah.
Already it is discussed.
I know. So we have two things, antenatal OPD and birthing units, and here risk categorization will be done through this. And the main thing is every midwifery unit should have an MLAC. Always we are using MLCUs, but antenatal clinic also is very important, and postnatal clinic and counseling rooms are also very important when setting. This should be taken care. When you are going through the operational guidelines, you will be knowing all these things. So waiting room, counseling room, exercise room, infrastructure, equipment and supplies, and human resource norms should be there. And operational, when we are saying operational, one is sensitization for the stakeholders, establishment of MLUs, community mobilization about the midwifery services, specific advocacy, trained manpower, equipment. Not only the manpower, equipment and supply also are very important. Clinical supervision and especially the mentorship by the midwives. Midwives not only teachers but also she should practice, and the teaching is very important. Monitoring and evaluation and review meetings are very important. So when we are saying the collaboration, always the midwife alone cannot manage. There should be a collaboration between all the healthcare personnel to provide highest quality care. And coming to the roles and responsibility, the medical in charge of the hospital is also very important in maintaining the MLCU. So supervision, collaboration, orientation to the facility, and mostly the nurture and advocacy of midwifery philosophy is very important. Coordination, monitoring, and continuous improvement. This should be done by the HOD of the OB also to take care to support the philosophy of midwifery. And coming to the role of MEs, along with the scope of practice, all the NPMs and MEs should be mentoring. Mentoring means it's not a simple word, it is along with them we have to practice. So these are the reporting and monitoring and budgeting that is there in operational guidelines you can go through. And these are the quality assurance. How can we monitor is through these 8 areas of concern. That is quality management, inputs, infection control, support services, outcome is very important. And accountability mechanism. Still now we are not practicing accountability mechanism. Wherever the midwifery care is there we have to be accountable for our services. So this is achieved only through the independent audits, facility audits, and feedback mechanism should be. And these mechanisms should be very mandatory in every MLCU. And in conclusion, though the Indian Nursing Council, State Nursing Council are helping us in regulation, so what are the key gaps? Regulation of standards of practice for nurses and midwives are not there. Absence of ICM recognized cadre for midwives, and lack of Midwifery Act and Midwifery Council. So Act is there, but we are not having that, mission is not have started. And lack of Nurses and Midwife Practice Act, amendments of Nursing Act with all elements suggested by ICM, regulation of working conditions in public and private sector, and standardizations job description to the position practice. These are some of the key gaps are there where we have to identify. So on this note, I'll be ending. It has been a decade we are listening about the midwifery, right? So if not now, when we'll be taking the action? So on this platform, I request SOMI, that is to sensitize, to operationalize, and to monitor mechanism and invest on midwifery. So a take-home message is, at this Assam conference, I am asking the SOMI to accelerate action and to involve all the stakeholders over here and to support us and advocate for midwifery and midwife voices to be heard. Not only the women voices, here the midwife voices also to be heard, because we the midwives, we are lacking a physical amenities in the hospitals. We don't even have a changing rooms and not even a washroom, where we are facing many difficulties. That minute things consider and make us it a noble profession where we can practice independently, freely, with the freedom, because we are much committed to do the midwifery. It is not just a commitment and compassion. By a calling we came into this midwifery. So give us a chance to provide a better services for our women, newborns and the families. Thank you so much. And Dhanyavad in Assam. Thank you.
And Dhanyavad also to you. Amita, you have described very nicely about from the NNMC to MLCU and what are the issues are there. But till now, legal.
We have a room with just one hydraulic cord. I think in future we will take it out that also. So that, and the mother doesn't feel that she's come to a hospital at all. We take the whatever is the trays or whatever equipments we need at the time of the birth, not before that. So I think resources are limited, as well as we can manage the mothers with that, and we have a very good established obstetric care just a door aside our MSU. So whenever there is a need, obstetrician either they come into us or we ship the mother there. So we have a very good established.
Thank you so much. But I had a question to you.
Yeah.
Do you have any quality management mechanism? And
Yes,
our
yes.
midwives are the members of that committee?
Yes, ma'am. We have like Kayakalpa. We are also been in these quality programs. They come to our institute also and look into the quality, whether the records are maintained, whether they have the equipments, everything. We have a same Laksha only we are following.
So that is equipment for providing care. But what about the care process?
Care process also we have mentoring. We have the mentors every time they are behind our learners, and then we have a very good quality system like mentors, and then we have IMEs on that, and we have our nursing superintendent also.
So do you have any quality check? No, that is quality for controlling. No, the whether there is any checklist every day you are doing that one.
Yes.
My question is in that point. No, whether you are doing that one.
Yes, ma'am. We have all the checklists, everything like Laksha. We have the checklists.
Yeah, ma'am. You can add.
I think by ensuring the quality of care, we need to follow some checklist, especially for obstetrical emergency management. We have a PPHS checklist, an eclampsia checklist. If the midwife or midwifery practitioners, if you are following this checklist, we can ensure the quality of quality care. And instead of thinking of what is not there, so you have to find out your own local resources. If it is available, we have an old cloth that can be sterilized and we can use. So such a way improvisation can be done for providing quality of care, especially by using the quality checklist of different type of obstetrical emergencies will help, I think.
Okay, thank you. Do you use this one safe birth checklist during the admission of the mother?
Yes, ma'am. We use the safe birth checklist as well as the Laksha case sheet also we are using it.
Okay, thank you so much. So next question, my question is towards the PEGU. Can you share some examples of innovative solutions or best practices in your center where your midwifery setting is there? Best practices or innovative practices.
Thank you, madam, for asking these questions. So first of all, a very good morning to one and all present here today, and I am happy and it is an honor to be here with you all. So actually, we are the first batch of NPME from Assam, and in our state, this NPME course, it is not yet started. So we have completed our just 6 months residential training from NMTI, Wardha, Maharashtra. So In my short period of experience, so I would like to say that there in NFTI Wardha, so during our practice we maintain respectful maternity care throughout the journey of a pregnant woman. So by maintaining this respectful maternity care, so we come to realize that by opening to the woman, by maintaining their dignity, by respecting them, by providing their privacy, and by considering their rights, so they are very happy, they are very satisfied, and they are very open up to do their deliveries, or they would love to engage with NPMEs or nurse practitioner midwives while their pregnancy journey. So that was the best and real basis example of evidence-based practice. So I have experience there.
But that is during your training time only you practice this one, or now at present moment you are also practicing this one in your own setup?
Actually, ma'am, here in Assam, our MLCU setup is not yet begin. The whole process is only processing. So, in real basis, we are not able to practicing it since we don't have any setup for MLCU. Yes,
Do you think that the rights of the mother is very important rather giving care to the mother? All the rights, no? To the maintaining the rights of the mother.
Yes, ma'am. I think that maintaining rights of mother, it is very, very crucial, because if we don't respect the rights, or we don't follow the rights and maintain the rights, so the whole care provision process, it will not be satisfied for the women and their families. Thank you.
Thank you, Pegu.
टेबल इज हाई, मेरे को उसके नीचे की टांगे काट दो ना. लकड़ी की टेबल है ना, हाई है, कटिंग टेबल, लो चाहिए, बाकी चल जाएगा. तो उसकी टांगे कटवा लो या किसी को बुला के और ठीक कर दो उसको. कौन बोलेगा? कोई कुछ बोलेगा? नहीं बोलेगा. फ्लोरेंस नाइटिंगेल का एग्जांपल देती हूँ. I'm sorry, I'm taking one more minute. Miss Florence Nightingale, when she went with her team to Scutari to look after those soldiers, she saw the condition. Condition was bad. No blankets, no dressings, no food for those soldiers who are suffering. She asked the storekeepers to give her things. Storekeepers denied. What she did? She took a hammer, broke open those locks, took out everything, used it. जिसको शिकायत लगानी है लगा दो. She did it. She did it. So she is not only known as a lady with the lamp, she is also known as lady with the hammer. Yes. So we should become, when time comes for the patient's sake, for the mother's sake, become a lady with the whatever. Okay. I'm sorry.
Thank you, ma'am. Thank you, ma'am. Once again, I would like to thanks to our speaker. Shall I continue, because it will take time? I know that there is so many interactions, so many questions are there. So I think the next session is waiting for that. Okay. So everybody need the interaction. Okay, you ask.
Ma'am, just I want to respond to the ma'am question about how exactly you are doing in the Bihar. So already we replaced labor table with the LDR bed. First thing, as ma'am was expecting, we have to give the comfort, and also it should be, height should be adjustable, and also,
Low height.
Yeah, LDR, but LDR, I think all we know, LDR bed will provide all those comfort. Even mother can go for the alternative birthing position in that LDR bed. First thing. Second thing, even we are providing the birthing mat. If mother want to deliver on the birthing mat, she can do that. And also we are providing the side bar to the wall, where she can hold the bar and she can do the squatting and deliver. So in our all the infrastructure layout plan, we are ensuring that kind of bar, even supporting bars, and we are ensuring that if time permits, you please visit to the Bihar and see our fully functional MLCU. You can, you are, sorry ma'am?
Where it is functioning, because we have been in Nalanda and other places, Danapur.
Yeah, ma'am, currently it's functional in the Danapur. Now, recently we shifted it into the new building. Now we have all the equipment. Second, GGS Guru Govind Singh Hospital. again in the Patna city. These two are the MLCUs are fully functional in Bihar. You can come and visit.
Okay, thank you so much. I think that in future also there will be more and more MLCU, and it will be mother friendly only. It will not be the healthcare provider friendly labor bed. It should be the mother friendly. What are the things are included in the guidelines? Beyond that only we can do along with the who have the experience only, because we have previously we have no midwives like that only which were practiced in the UK or in the Sweden also. They have a bed. The delivery happen in the bed only, not in the labor table. We are accustomed with the labor table only, but now the labor table is little change. I think that in the future also it will take more and more change. Okay, so thank you so much once again all the panelists for giving the third provoking session.
It was a very productive session and our speakers has given us a fresh insight on the topic. Now we would like to felicitate our speakers. To begin with, I request Professor N. Monica Madam to kindly felicitate Dr. Narendra Goswami. Thank you, ma'am. Thank you, sir. Now, I would like to request Mrs. Draupadi Thapa, madam, to kindly felicitate Mrs. Amita Shravantika. Thank you, madam. Now, I request Ms. Puravi Das, madam, to kindly felicitate Ms. Ritu Kumari, madam. Thank you, madam. Moving forward, I request Dr. Inu Boro, madam, to kindly felicitate chairperson of today's session, Mrs. Mitali Adhikari, madam. Thank you, ma'am. Last but not the least, I would like to request Professor Dr. Nirmali Gogoi, madam, to kindly felicitate the moderator of today's session, Dr. Sushila Singh, madam. Thank you, ma'am. Can you have a big round of applause for all the speakers present here for such a wonderful session? Thank you all.
To make this moment even more meaningful, we are honored to have with us our chief guest for today's event, someone whose achievements and dedication continue to inspire many. I request everyone to join me in warmly welcoming our chief guest, Sir Dr. Lakshmanan S., IAS Managing Director, NHM Assam, Secretary Industry, Commerce, Public Entrepreneurs, Mines and Minerals, Government of Assam. I welcome you, sir. Now, it is with great pride and deep respect that we welcome our guest of honor who has graciously joined us today, Sir Dr. Umesh Fangso, Director, Health and Family Welfare Department, Assam, and Sir Dr. Abhijit Basu, Additional Director of Health Services cum Registrar, Assam Nurses, Midwives and Health Visitors Council, Assam. It is now my honor to welcome a person whose leadership, wisdom, and unwavering support have been a guiding light throughout this journey, the President of SOMI. Please join me in welcoming Madam Dr. Usha Ukhande, President, SOMI. This conference would not have been possible without the consistent support and leadership of the General Secretary of SOMI. Therefore, with great respect, I now welcome the General Secretary of SOMI, Madam Dr. Asha Bhatt, whose commitment and efforts have played a vital role in the success of this event. Now, it is my honor to welcome someone whose leadership, dedication, and vision have been at the heart of this entire event, from shaping the program to ensuring that each moment carried meaning and purpose. Please join me in welcoming the chairperson of the conference, Madam Professor Dr. Geeta Das, Principal, Regional College of Nursing and Dean of Nursing, Srimanta Sankardev University of Health Sciences, Assam. It is with deep appreciation that we now welcome the driving force behind the smooth execution of this conference, our organizing secretary. Please join me in giving a warm round of applause as we welcome Madam Dr. Lukima Saikia, whose efforts, coordination, and commitment have made this event a memorable one. Thank you, sir. Thank you, ma'am. Now, as we proceed, I would like to take a moment and felicitate our esteemed dignitaries. Their presence here today is not only an honor, but also a testament to their support, encouragement, and commitment to the values we uphold through this conference. Therefore, may I request Madam Professor Dr. Geeta Das to kindly felicitate Sir Dr. Lakshmanan S. Thank you, ma'am. I now request Madam Dr. Asha Bhatt to kindly felicitate Sir Dr. Umesh Pangso. Thank you, ma'am. I kindly request Madam Dr. Lukima Saikia to kindly felicitate Sir Dr. Abhijit Basu. Thank you, ma'am. I sincerely thank each of our respected dignitaries for gracing this occasion and for the inspiring roles you continue to play in your respective fields. Your support truly adds meaning and value to the gathering.
Moving forward, I would like to request the chairperson of the 17th National Conference, Professor Dr. Geeta Das Madam, to kindly read the report of the 17th National Conference of Society of Midwives India, Assam chapter.
A very good afternoon to everyone present here. You are never too old to start over. Every day is a chance to make sense, to create the life we want. So respected today's chief guest, Dr. S. Lakshmanan sir, and this is Dr. Umesh Pangso sir, and Dr. Abhijit Basu sir, Registrar of the Assam Nursing Council, and all respected dignitaries on the dais and of the dais. So I like to read out this report of the 17th National Conference organized by Assam Sector in the collaboration of Regional College of Nursing, Guwahati. A very good afternoon once again to present here all of you, and thank you everyone again for being here today. I, on behalf of organizing committee as a chairperson of 17th National Conference, which was organized by Society of Midwife India in collaboration with Regional College of Nursing Guwahati, Assam, on the theme of midwifery practice game changer for mothers and newborns. These conferences for 3 days long program from 3rd April to 5th April 2025 at the Guwahati Medical College Auditorium, Guwahati. This conference brought together around more than 700 nursing officers, ANM, academicians, researchers, NPMs, NPME, members of regulatory bodies, policymakers, postgraduate MSc nursing students, and GNM staffs, and all the who have registered as a midwife in this conference. This conference explored the shifting dynamic of midwives' responsibility in an era where the midwives can be active partner in healthcare progress. Deliberation over the 3 days they delve into the evolving roles of midwives in the healthcare sector. Then day one, what was our program? I'd like to read out. The first day conference started with the first plenary session on the topic regulation and the legal guidance for midwifery practices in India. In this session, Mrs. Lieutenant Colonel retired Manmoni Bhankar Madam was the chairperson and Mrs. Swapna Thakur was the moderator. The speaker of the session were Dr. Dilip Kumar, President, Indian Nursing Council from New Delhi. He has joined in the online only. He had highlighted in his speech about achieving universal health coverage of midwife delivered intervention by 2035. The second speaker was the Dr. Vidyut Latha, DD and Telangana. She presented on the topic Ethical Professional Standard in Midwifery and ended with the quote, "A truly amazing midwife is hard to find, difficult to part, with the impossible to forget." The third speaker was the Ms. Ravani Mandal, Registrar West Bengal Nursing Council. She talked on the government policies and maternal health programs, midwife-led care, roles of midwives in community, implementation of midwifery services, and initiative in India. After her session, the dignitaries were felicitated with the Gamusa certificate and memento, which was the one horn rhino of Assam symbol. And the event comments with the auspicious lighting of the lamp ceremony, signify knowledge and wisdom. This solemn tradition marked as a formal inauguration of the conference, bringing these esteemed dignitaries from the various spheres of the governance, administration, academicians together, including Dr. Siddhar Singh, IAS officer, Commissioner and the Secretary, Medical Education and Research Department, Government of Assam, Dr. Anup Kumar Barman, Director of Medical Education, Assam, Dr. Dilip Sandon, he is the renowned editor of as a journalist, Assam Bani, Guwahati, Dr. Usha Ukhande, Madam President of SOMI, Dr. Asa Bhatt, Madam General Secretary, Dr. Gita Das, myself, is a Principal of Regional College of Nursing as well as the organizing chairperson, Dr. Lukima Saikia as a chairperson as well as sector secretary, and also Dr. Unmona Borgohai Saikia, Principal, College of Nursing, AIMS, Guwahati, as well as Assam Chapter President. And all the dignitaries released souvenir and another book, abstract book of the 17th National Conference of SOMI. It was a mark of our this Assam Chapter conference. The keynote address was given by Dr. Prakasava Madam, who was the founder and advisor of the SOMI. She highlighted about the history of Society of Midwife India and difference between obstetric and gynecology and midwifery, and showed the video of two testimonies about the satisfaction of midwifery-led care, which was given by a father and a mother. It was followed by the panel discussion one on the topic NMM, that is Nurse Practitioner Midwife program, a confluence on narrative, which was shared by Dr. Parul Kibiliola and as a chairperson, and Dr. Rasmi Viswanathan as a moderator. The panelists of the session were Srimati Ivory Kharduit, DD and Meghalaya, Mrs. Fatima Zuelit, Principal cum NMTI, Inserts, Ethel Jasaria, NME, Astrika, and Miss Somia, NPME, Bani Vilas Hospital. The next session was the roundtable discussion on the topic, Who is Midwife in India? Coordinated by Mrs. Asa Bhatt, and the 5 participants present on the discussion were the Mrs. Draupadi Sharma, Mrs. Jayalakshmi, Mrs. Sangeeta Patel, Mrs. Sunita Chakrabarti, and 2 volunteers JNM, Mrs. Tripti and Mrs. Shravanata. And this discussion focus on the question regarding the public image of the midwife in India and the official recognition for the midwife in India and professional identity. Are the nursing and the midwifery same or different from each other? In the second half, there was another session that is called the 4 skills session. We have organized including the newborn resuscitation, IUCD insertion, antenatal exercises, and physiological management of 3rd stage of labor by Fernandez group of people. And concurrent session were going on in the conference hall, lecture hall, ONG hall, Guwahati Medical College Hospital. In the first concurrent session, Dr. Barkha Devi was the chairperson and Dr. Rupasri Das Gupta was the moderator. A total 4 participants presented their research studies. In second concurrent session, Professor Ranjita Devi was the chairperson and Sarba Roy was the moderator, and 5 participants presented their studies. In the third concurrent session, Professor Bibi Bordoloi, former principal of Regional College of Nursing, as she has shared, graced her chair as a chairperson, and Dr. Gita Paranda was the moderator, and the 5 participants had presented their research studies. Second day event was on 4th April. The second started with the second plenary session on the topic preparing the midwives for maternal and child care in India. The chairperson was Dr. Parul Datta, and Dr. Hardik Kaur was a moderator, and speaker were Dr. Radha Rama Sri and Miss Sital Samson and Mrs. Hatel Bhatia. Next was the second panel discussion on the topic on the advancing maternal health services through midwifery model of care. Dr. Usha Akhande Madam was the chairperson, and Brigadier Punita Avnesh Sharma was the moderator. The speaker of the discussion were Dr. Deepika C. Khakka, and who is the nursing advisor of the Government of India, and Mr. Zeno, Dr. Vikas Jadov, and Mr. Amit Nagaraj. Then there was a spirit about the Himalaya and importance of baby, which was presented by Mr. Neil Sajar, Regional Manager of Himalaya. It was followed by the roundtable discussion on the topic midwife scope of the practice, which was coordinated by Mrs. Samili Roy. Then it was followed by the concurrent session in the 3 different hall skill station. Executive meeting was held afternoon, and in this executive member SOMI and all sector secretaries of the all state presented their history and background, establishment, project, target, their activities, etc. Sector secretaries of the total number of the 17 states had participated in the executive meeting. The newest state which represented for the first time in that is the Nagaland. The executive meeting was followed by the general body meeting, which was coordinated by Ms. Sandharani, which all the executive members and sector secretaries. They mainly focus on the upcoming ICM conference in the year 2026. The second day program ended with a cultural event followed by dinner. Then today it is the third day and the last day of our event, that is today is the 5th April. On this day, plenary session was conducted on the topic structural and functional changes to promote midwifery practice in India. It was members were also present in this session. Mrs. Mitali Adhikari was the chairperson, and Dr. Susila Singh was the moderator, and the speaker were Dr. Narendra Goswami, Mrs. Anita Shravantika, Mrs. Ritu Kumari. It was followed by the third panel discussion on the topic sharing experiences and challenges by midwives. The panel discussion was coordinated by Mrs. Bandana Das Madam as a chairperson and Ms. Alpana Moi as a moderator. The panelists were Mr. Pokras, Dr. Prasanna, Ms. Nagartha, and Ms. Purnima Pegu. The last session of the third day of today's was the roundtable discussion on the topic advocating for midwifery in India, which was coordinated by Ms. Manasi Jana. The expert present were Ms. Jalpa Prajapati, Ms. Priscilla Darbar, Ms. Ritu Kumari, Ms. Agatha Sefar, Ms. Arpita Maitri, Ms. Buluma Soikia, and Ms. Sangita. All the skill station and concurrent session were held simultaneously in second hall. There were a total of 12 poster presentations on the second day, and they were displayed at the both sides of the entrance of the main hall. Stall of the Zapi Brothers Publisher, Himalaya Vision Publication also displayed their product and the different books in the conference venue. All the posters about the SOMI activities of the different state chapter were also displayed at the side of the entrance hall of this main hall. The third day 17 SOMI National Conference concluding remarks reflected the key takeaway from all the session, emphasizing collaboration, resilience, and innovations in the addressing future challenges of midwives. The conference highlighted the significance of governance, policy reforms, and leadership in the shaping a sustainable future for midwives in India. Expressing gratitude to the speaker, panelists, participants for their insight and engagement. The program was a huge success due to the contribution and participation of each and every one present here during these 3 days national conference. We hope this conference has been informative, engaging, highly motivating, and once again I like to thank you to all your time and attention and support. We appreciate your presence and looking forward for future collaboration, and I like to give the once again thank you and long live SOMI. Thank you.
Thank you, madam. As we all are aware that on all the 3 days of the conference, there were enlightening scientific sessions. Many participants presented oral and poster presentation. Now it's time to declare the awards for the best oral and poster research paper presentation. Now I would like to request Professor Dr. Manasi Sen Gupta, Chairperson Abstract Program Case Studies and Experience Sharing Committee, to announce the awardees.
Thank you. A warm evening, dignitaries on the dais, and all my dear colleagues. On behalf of entire Scientific, Abstract and Experience Sharing Committee for the 17th National SOMI Conference, it is my proud privilege to announce the best paper for oral as well as poster, held in various 3 days concurrent sessions. Now for the best oral paper presentation, it is Miss Gifta S. Round of applause for her. She is representing CMC Vellore. I request Chief Guest Sir, Dr. Lakshmanan, to kindly give the award. And for the best poster, it is Prashanti S, again from CMC Vellore. I request Dr. Umesh Pangshu sir to give away the award.
Thank you, madam, and congratulations to all the participants and the awardees.
One of the most meaningful parts of any conference is hearing the voices of those who live the experience, our delegates. Therefore, we now invite a few of our delegates to come forward and share their thoughts, insights, and experiences from the past few days. Their stories are what truly bring this conference to life. So let's listen with open hearts and minds. Therefore, I request anyone from the audience, from our delegates, to kindly come up on the stage and share your experience.
Someone please come. One person, two people.
Yes, ma'am, please. Delegates, please come up on the stage and please share your experiences with us. Yes, ma'am, please come.
Good afternoon to all respected teachers, respected SOMI members and dear delegates. This 17th National Conference is very knowledgeable and fruitful for all of us because learn new things in this conference, and this conference is very fruitful for all of us because enjoying many things like with the help of learning many things like respectful maternity care in the way masti time like cruise masti and food organizing team, thank you so much for nicely organized all the things and give all respect with delegates from all of them. Thank you so much to all. Thank you, ma'am.
I request someone else from the audience to kindly come up and share your experience. Yes, ma'am.
Good afternoon, respected all the dignitaries of the dais and the delegates from the different parts of the India. And my special actually gratitude and congratulations to the organizers, the Assam chapter of SOMI. And apart from that, my previous speaker, whatever she said about the teaching learning activities, I think for me, last 31 years, I am in the nursing profession. For me, this is the first platform where myself, I have really learned whatever amount of time I was able to share with all these resource person and all the senior people here. It has been really wonderful experience, and my heartfelt gratitude towards our very own respected Principal Regional College of Nursing, Dr. Lukima Saikia. I just want each one of us should give a very huge round of applause because this is an incredible arrangement, organization, and each the staff has been planned, I think, in a very meticulous way. So credit goes to entire core team members of this program who has worked relentlessly day and night. Myself, I have not worked very much, of course. So I had health issues. I was running through viral fever. But again and again, if I talk about the teaching learning activities, yes, the person who has presented the scientific paper and the people who are here to receive something new and from the past, the present, and for the future upcoming, excellent. And I want to also mention about this skill lab, sir. The skill lab, it's really a remarkable one. And once again, I take this pride and privilege from the Assam chapter of SOMI that yes, each one of us we can do, we can fulfill, and we can move on if we have a determination to do so. Thank you for listening, and once again, a huge round of applause for each one of us. Thank you.
Thank you, ma'am. Anyone else who wants to come up and share experience? Yes, ma'am, please.
Respected dignitaries on the dais and off the dais. We are very happy to attend this conference, and this is the second conference I am attending. And after coming here only, we actually learn about respectful maternity. So one thing I wanted to tell you is the thing we are not practicing, it's a waste, it is useless. So we are learning many things here, but we are not able to practice in all states, especially in Kerala. So we are very sorry for that. And we wanted to practice that also. And it is the right of every mother to have a respectful maternity and a dignified labor. So I hope we could able to do the things. Anyway, I'm thankful, especially to Pragashima ma'am, who is very dedicated and conducting and guiding us in all these things. And the Assam unit, we are arranging everything well. And thank you so much. Thank you.
Thank you, ma'am. Anyone else who wants to share their experiences, kindly please come up.
Very good afternoon to all. From this SOMI, I would like to say because of SOMI, I learned so many things. All SOMI meetings I used to regularly attending from Hyderabad to Assam. So what Shainimol was telling, the respectful motherhood, because the boldness to say it is the SOMI was given that one. So I'm conducting online antenatal consultations. Wherever I am meeting a pregnant lady, I am asking everything, whether in the celebration or marriage or function on the way or the traveling or the bus stand. So I am started speaking about the pregnancy and antenatal care. So this courage, boldness, I got from the SOMI. Especially I am thanking Pragashama Madam, the founder of SOMI. So we are trying our best to contribute to all antenatal mothers and postnatal mothers. Still many are calling us what to do, how to do. Even though doctors are conducting in Kerala, but we are strengthening the ladies, whatever are the signs and symptoms of labor, how they can be strengthened, how if the doctors only they are consulting the abdomen scanning and all. No? Even they are not bothered about the feeding and all. No? So the midwives. So whatever the nurses we are giving, so I am thanking God. So we hope so one day Kerala will also have the. We had 40 years back midwives are there, practicer. We were the students that time. So really once again I am thanking the SOMI office bearers. So we'll hopefully stop it. Thank you.
Thank you. Thank you to our delegates who just shared their experiences. Your words have truly added depth and warmth to the conference. Once again, thank you for your sincere sharing and for being an integral part of the conference. Now, I would like to invite Madam President SOMI, Dr. Usha Okhande, Madam General Secretary Dr. Asha Bhatt, Madam Joint Secretary Shanti Victoria to announce the next destination of our next SOMI conference and put forward an appreciating note to the organizing committee members and SOMI executives, Madam Sandhya, Madam Komali Priyanka, and Madam Shanti Victoria, and also put forward a few words and token of appreciation for our sponsor partner, Himalaya Baby Care, the anchors of the conference, event manager Pranjal Dekka, and Sona Datta, Elite Catering.
Good afternoon, respected chair, chief guest of today,
and guest of honor, special guest, Dr. Geeta Kimaji, Asha, our very senior SOMI advisory board sitting here, and SOMI executives, and SOMI office from Hyderabad is also here, and all of you, the delegates and the sponsors of this conference. It is, I never had a doubt that how the Assam conference will go, but Geeta ji used to have a little doubt. She said she's doing it first time. I said we always do it first time, and then next time. But she has done a wonderful job. She and Rikima madam, yes. As others also said, it had been a wonderful conference. All arrangements were really superb. Food was very good, accommodation very comfortable, everything. Place is very nice here, open, good place. We could go around. So those were the physical things. Learning, I'm sure most of us, we have learned a lot. All these 2-3 days, we were very busy listening to each other, sharing experiences, and gaining some insight into the midwifery initiative that Government of India started in 2018, and it is most of the work was, the deliberations were going around that only. And another thing is that Assam is also taking up this project in the near future. We had a discussion today that from our learning from other states where this program is going on, now Assam is taking it up. Definitely you will learn from those experiences and do it in a much better way. And for me as a SOMI president, this is my first conference after I took up as presidentship. And Dr. Prakashama was saying this is super. Yes, for me also it is very super. Very successful one, lot of learning. And today it was announced that there is going to be ICM conference, International Confederation of Midwives conference in Portugal next year. For that, already people have started working on it. One project that we have taken up is we are going to RMC. Most of the people who were present saying their experiences, respectful maternal care. We have already chalked down a research project on that. It's going to be finalized, and we are going to do a pan-India survey, research survey on how do women feel about the respectful maternity care, whether they're getting it or not. That paper is coming up under SOMI by one of the Chhattisgarh SOMI chapter secretary, and it will be presented in the ICM. So this is what she announced today, and in 2 months time we are going to make it and then work on it. So that's one thing. And second thing that has come up in this conference is when we were having a meeting with Japaigo yesterday, that we are going to work on now the situation of whatever this midwifery initiative has been started in many states. What is the situation and how can we improve on it? With that, we are going to prepare a white paper and submit it to the Government of India and all state governments also. How can we now improve on if we have had some not so good experience with that program. So these very wonderful 2 things have come up. Besides that, many other things, innovative things. People are thinking now, how can we start our own clinic? Many of them, they discuss midwife-led clinic, how can we start it? So that project also, some people are going to take up. So as I say, this conference is going to be a milestone in the history of midwives, that new things, innovative things are coming up. Thank you very much, all of you, all the organizing committee and people of Assam. Thank you. Okay, somebody said the next conference. Next conference, there are 2 states who have opted that if they want to have. One is Andhra Pradesh and second is Madhya Pradesh. We have not yet finalized when it's going to be in 2027, not in 26, because 26 we have ICM. So in 27, 2 states have offered. We have yet not finalized. We will soon finalize and let you people know. Thank you.
Thank you so much, ma'am. I now request all the organizing committee members to kindly come up on the stage along with Madam Dr. Smriti Rekha Khaunt, Dr. Megha Tiwari Madam Ms. Jubida Rinja, the anchors of the concurrent sessions, along with my co-anchor Kriti, to the stage, and also our catering partner and event planner. Sir Pranjal Deka and Sir Soma Datta. Sir Sona Datta, sorry.
They were the anchors, sir, for scientific paper presentation for concurrent session. Dr. Smriti Rekha Khaunt. Huge round of applause. Dr. Megha Tiwari. Mrs. Ponky Locker. She's anchoring for 3 days. Miss Kriti Sethi. And we have two anchors from AIMS Guwahati. They are not present, we will be sending them. Cultural, Kakoli and Ruma Datta. We have also event and catering, yeah. For catering, Mr. Sona Datta, as you all have appreciated his food. A light catering. Then we have Pranjal Deka for event management. So on behalf of Jubida Rinja, Dr. Megha Tiwari will receive her memento. Now for cultural, Kakoli Datta. Ruma Datta is not present. Next, I request all the organizing committee members, please come on to the dais. We also want to honor them with a Fulam Gamusa from the organizing committee members. Please. Okay. Also, we want to call our two photographers for 3 days. Please, Dada, come on to the stage. But we will click for you. Now we want to appreciate our General Secretary from SOMI headquarters, Dr. Asabhat Madam. Asabhat Madam will honor our photographers. Okay. Dada, Okay, next, for our all organizing committee, I want to appreciate by our SOMI Secretary and President Madam to give away some token of appreciation to them.
Wonderful job for madam.
I also want to call on the stage Miss Reshma and Soma. They were doing tremendous job behind the stage. And Aparajita Goswami. Come, three of you. I also wanted to call our most beloved Sandhya Rani, Kamali Priyanka and Sanganti Victoria Madam on the stage. They are from headquarters. Please huge round of applause. Because of them only we could do all this conference a possible one.
low battery.
We want to honor our Sandharani from headquarters. She is from Telangana. Please use round of applause for her. Our Joint Secretary Santri Victoria Madam from headquarters. Komoli Priyanka. She is also from Telangana, from our headquarters, SOMI. Now we want to appreciate Soma, Aparajita and Reshma. They were the force behind the stage. They are helping during our poster presentation and all digital programs. Now, I would like to request guest of honor of today's closing ceremony, Dr. Umesh Fansu sir, Director of Health and Family Welfare Department of Assam, to kindly enlighten the gathering.